ORM Fertility, where inclusivity is not just a buzzword. I am so excited about a very special guest joining me from Portland, Oregon, Dr. Barbieri. I am thrilled to have you on the show. Thank you for being here.
Thank you so much for having me. I'm delighted to be here.
I'd love to start by finding out what drew you to the field of reproductive medicine.
That's a great question. When I was in medical school, I fainted during my first pelvic exam, and I fainted my first day on my OB/GYN rotation. So I knew this was the right field for me. And then when I realized I loved OB/GYN in general, because I really liked taking care of women, especially healthy women, and you could provide comprehensive care, not just their diagnosis, but then their procedures, and stay with them throughout the course of their lifetime. I felt like that was the right field. And then once I started delving into OB/GYN in my residency, I realized I was really intrigued by hormones and infertility problems in general, which led me to the path now. I have to say, I'm so grateful that I have this job and this experience, because I'm going to sound like the hair club for men guy. Not only am I a doctor, but I'm a patient too, and struggled with my own fertility issue for my third child, and actually went through treatment at my own clinic. And it was, it's such a great experience to be able to go through that process. And fortunately for me, it worked.
That's amazing. Thank you for being open about it too. I think it offers some accurate empathy with your patient population. I didn't even realize that. How do you feel like it shifted how your consults or your relationship with your patients once you were in their shoes?
I was surprised that had my own personal challenges during this actual treatment. For example, when I went in for my ultrasounds, I closed my eyes and I plugged my ears because I did not want to hear what my colleague was saying in terms of my follicle count, because I was so scared it was going to be abysmal. Wow. And I made them call my husband for all of my medication doses, because I knew too much, and I knew that if you were on one dose, it meant you weren't responding. I completely understand how painful burning Menopur can be, and how a ganirelix needle is now dull. So I feel like I can talk my patients through, like, don't worry about the shots. The first day is the worst. By the last day, you're going to be doing them as you wait for me to come in for your ultrasound.
Yes.
I did it myself.
Wow, that makes such a difference. I know now I'm having flashbacks to the progesterone.
Right?
And how blue I was.
Yeah. And once you've experienced it, you can talk openly about some of those challenges. And I tell my patients what my experience was like. And, you know, I'm very fortunate because things worked out, and I was lucky to be able to be treated where I actually work, which I firmly believe can provide excellent patient care. And I experienced that. But to be in the patient's shoes was an interesting and really eye-opening experience.
Incredible. I mean, I myself was a patient twice, both for fertility preservation and then also then for my frozen embryo transfer after I had survived cancer. So, you know, I had gone through a lot of different medical treatments already, but I always felt that it was empowering to do the shots myself, because I felt like it was this one thing that I could control, because so much of infertility and cancer feels out of control.
Yes.
Did you experience that at all, or you just gave it to your husband and was like, you know, in the second half, doing it?
Given that I knew so much about this field, since it's what I did, my husband wanted tried really hard to be supportive, and he wanted to give me the shots. And so for the first couple of days, he was doing the injections, and then his mom fell ill suddenly, so he had to leave emergently, and I did the rest of my shots. And I was actually grateful to be able to do them myself, because they didn't hurt as much, because there was no anticipation.
Ah, right. Okay, that makes sense.
I tell my patients, like, I try to comfort them and say the shots really aren't that bad, especially if you give them to yourself. And I agree. It's nice to be in control of that one segment, because you can't control how your ovaries are going to respond, or how many eggs you're going to end up with retrieval, or how many potential embryos you might have.
Right. Now, we were talking kind of in the pre-show of the uniqueness of Oregon. Your clinic and you yourself treat patients from multiple different states. But even in Oregon alone, you might have patients that are 6 hours away, because the majority of clinics happen to be in Portland.
Correct.
So telemedicine's been part of your world for your entire practice.
Absolutely. We treat patients from throughout the US and from over 40 countries. And so we are very comfortable in talking to patients through telemedicine, Zoom or Skype, or other ways to communicate over the phone. And our team has become really, really good and honed in on ways to make your treatment seem seamless, even if you're starting from afar. And sometimes the first time I'll actually meet a patient in person is halfway through their cycle, but they still have good outcomes and feel cared for, because we try really, really hard to make sure that they're communicated with and they're getting all the accurate testing that they need, and they feel like they're right in our office, even when they're multiple hours away.
Right. Now, this is a unique aspect of reproductive medicine in our field in general, is that medical tourism exists across states in the same way it exists across countries in Europe. And I think that the access is something that you're really known for. I truly mean it, that inclusivity is not a buzzword for you all. You've created such unique programs so that every human feels a home, with ORM Fertility. Can you take us through a couple of those programs and what's unique about them?
Yes, sure. We firmly believe in everyone's reproductive rights, and being able to practice in Portland, Oregon, which is such a liberal environment, has really allowed us to blossom in that way and support not just our local patients, but patients from all over. And we've subsequently developed kind of some subgroups to help support specific patients. So we have a website called Sharing Healthy Genes, which covers tries to cover all genetic testing. And
very, very educational. I love that website.
Yes. So to provide unbiased educational content for people who are looking for reproductive health avenues related to genetic disease. And then our newest website is called Love is Family. And this is kind of the trademark of ORM, because that's what we believe. Love is family. If you're a single individual using donor sperm, if you're a same-sex male couple, same-sex female couple, transgendered, needing fertility preservation, heterosexual couple trying for years, older, younger, all races, all ethnicities. At the end of the day, what's your family? It's built on love. So this website is to target all communities, and especially the LGBTQ community, and has multiple examples of former patient stories. So they're all true stories who've gone through various treatments with us and have been successful. And that's really meaningful to us, because even in Portland, Oregon, which for anyone who's ever been here is such a liberal, rainbow flag everywhere type of small city, I've had so many lesbian patients say to me, the whole reason I came to your clinic was I looked on your website and you had a rainbow flag or a rainbow circle, and the other 3 clinics in our city don't at all. And I knew that I was going to be safe with you, and I was shocked. That's so simple.
Oh gosh, that's like a gut punch. I knew I was going to be safe with you. That's a beautiful sentiment, and means everything, because truly every person just wants to be treated as a person, and dignity and respect. And in this process, there's so many things, from reproductive laws to what I think is the insanity of the definition of infertility in order to access, insurance. It's like, gosh, if you're a same-sex couple in the absence of sperm or egg, the definition of infertility on day 1, not month 12, not month 6, if you're over 35. So let's remove that language, right, from access to care, because we've not done that across the country. We still have things kind of stacked against various marginalized communities. Absolutely. So I love that you guys have taken that stand and gone forward. But it's not just that. I mean, one of the things that we really noticed and why we picked you as I love that. So Andrew, you have a fan who's saying, we love our doctor.
Hi, Andrew, Jeremy.
Hello. Aw, I love that. I love seeing that love come through. One of the things is also just the financial planning, because some of these treatments do get pretty expensive, because surrogacy, egg donation, third party, the dollars start to stack up, and heading into it, you do have a financial, part of the consultation is part of your packaging. So, I think that that's also kind of a unique aspect of access to care for you all. Yes. What kinds of financial, they're just loving on you. We love her too. Thanks, Jeremy. I wonder if they can post a picture. So what kinds of financial consultation or counseling do they get when, they're evaluating the more expensive third-party options in the practice?
We have a whole separate financial team and financial counselors who reach out to the patients individually after their new consults to say, because I will tell the financial team, this couple or this individual is interested in X, Y, or Z, or they don't know, so send them all the information. And then they will reach out and say, kind of with a drop-down menu, like, if you're thinking about this treatment, it's going to range from here to here. Once you look at this document, please call us. We'll talk through what your insurance may or may not pay for. We will talk, and then what your out-of-pocket expenses, and we'll talk through what financing options are available, what medical loan companies are useful,
right.
And then even given that there's not mandated coverage in Oregon, a lot of patients, local patients will say, who should I work for to get coverage? And they'll say like, well, these are the current plans that have coverage, and these are where a number of our patients come from. So we try to hold patients' hands through that process, because that is as complicated and stressful as the medical part.
It is, without a doubt. It causes delays after delays. It even causes delays for patients not getting that first consult. One of the things that your clinic offers for any patient that comes to you through the Fertility Answers app is a free 1-hour consultation, which is incredibly generous. And I'm so grateful for the gift, because so many people don't take that first step because they can't see from the first step to the 50th step, and it feels so overwhelming, and they feel like I'm never going to be able to afford it. But if they get their foot in the door, if they get the first consultation down, they can get that ball rolling and then find out what all the options are.
Yes, absolutely. And we are grateful for patients just coming in to talk to us. And I have to say, my colleagues and I are really upfront and honest with our patients. And I will tell a couple, if they are young, don't get a second mortgage on your home, don't work 5 jobs, spend the next year saving, come back and see me, your success rates will be the same. Or for a woman in her early 40s, it becomes a very frank conversation about, can you only afford one treatment? If so, what treatment should that be? Let's talk honestly about it, because we acknowledge the financial burden that this is going to put on you. And I don't want to paint a rosy picture, have it not work, and now ask you to turn around and spend a whole nother lump sum of money on a different treatment.
I'm very grateful to hear that. As someone who advocates for very direct, clear language in this space, I'm very grateful to hear how clear that conversation is. You guys treat, whether somebody is fertile or infertile, you treat both. You have people coming to you for egg freezing so that they can plan their family when they want to plan for it. You have people coming to you for, single parenthood with donor, like I have been. And, you have same-sex couples, and you have heterosexual couples who are infertile. So I love the flexibility and how you go about, managing care and kind of bringing that to the forefront. The one area, though, that I see that is also unique is how many genetic counselors you have on staff. And that is something that you bring to the table. We have such a shortage of genetic counselors in the whole country for all things genetics, that I feel like it's a luxury to get to hire one full-time, let alone more than one.
Yes, we are, again, thrilled and grateful that we are lucky enough to currently have 3 genetic counselors on staff. Genetics has become such an important part of the fertility process, with the amount of carrier screening available, with the PGTA, PGTM, PGTSR, PGTXYZs that are available, that as a medical
acronyms that the government has.
Yes, it's hard to keep up, let alone effectively counsel patients on the nuances of some of these testings. And so we have our genetic counselors as our partners to help patients through this process. Additionally, the genetic counselors do family histories on all of our patients, and sometimes they recognize that there's a potential cardiac gene or a cancer gene that, as a physician, I didn't pick up because of certain subtleties. And then those patients get offered genetic testing, and then that might influence their decision to do an IUI cycle versus an IVF cycle, because they actually recognize that they have a gene and they don't want to pass that on to their child.
Wow.
And if, heaven forbid, during a pregnancy, something comes up, our patients can always reach back to our genetic counselors and be like, hey, talk to me through this. What do you think about that? So they're a vital part of our care.
Incredible. That continuity of care, because you don't always, start a cycle. I mean, it was 5 years before I got to do my embryo transfer when I did my fertility preservation. But the continuity of care of getting to come back to the same practice and have the same people greet you and remember you and be part of your journey is, I think, a very family kind of oriented touch.
Yes, absolutely.
Now, for those patients who are kind of on the fence or they're waiting to get started, what would you recommend? What's your advice to them?
Don't wait. I mean, I kind of joke. I say, you don't have to try for a certain amount of time before you contact us if you're in a heterosexual relationship. Talking to us doesn't force you to then move forward with treatment. It's just an educational consult. Just call and we would happily talk to you and just explain things. Even if you're not sure you want to start to try to have a family, what are the things we should be thinking about? Understanding what a timeline could look like. Because if you're 42 and on the fence, you really need to get off the fence. But if you're 22 and on the fence, you can hang on that fence for a lot longer.
Right. That's great. I love that so much. So, I mean, this has been an incredible treat getting to know you better. I remember meeting you at ASRM, but I'm happy to get to know you better. I'm really pleased to be partnering with ORM Fertility. You know, really great clinic. And remember that for everyone that is accessing us on Fertility Answers app, you do get a free hour consultation, which is a very generous gift. Now's the time to take advantage of it. Telemedicine has long been since a part of their practice. Thanks, Dr. Barbieri. I hope that I can get a chance to see you in Portland once we can get back on airplanes again.
Yes, absolutely. Thank you so much for having me. Everyone have a great evening.
You're welcome. Take care.
All right. Bye.